Let's go ahead and open up the doors to a daily with Doc, zoom.com. That is how that you are able to join us here live in the Zoom room, Monday through Friday from 12 to 12:50 p.m. Pacific time. Hello and welcome back, everybody. My name is Becca Dukes. As the hostess of this program, I am honored and privileged to be able to be part of your journey in discovering what you can do on your own to help yourself find a better health journey. I know I found a better health journey. My co-hosts have all found better health journey, and that's how we are able to come together and provide this information to you with confidence in knowing that the research that went into the formulations that we share on this program really do work. And the research that has been done is done by the doctor that we host here on Daily with Doc. But before we get to him, I just want to say hello and welcome. Hello to those in Radio Land and all the different platforms, YouTube, Rumble, Spotify, Amazon Music, iHeart, Facebook, Brighteon, all of these different platforms that we are on now. We just want to say hello and welcome. And you're going to be thanking yourself for tuning in to empowering information. Folks, this is an investment into your health. Whether it's time or money, it's still an investment. So if you were invited by somebody specific, we are a resource for an amazing group of people, of coaches that have gone through, most of them, a certified holistic health coach course, who the course teaches deep into the 4 areas of health, how deficiency affects those 4 areas, and then how we are able to use the products that Dr. Wallach brought to the table as solutions to correcting those deficiencies. And we also look at other areas of the health. It's the Institute of Holistic Health. So it's not just about what you put in your mouth, but it's also about what you surround yourself physically and mentally, emotionally, spiritually with as well. Because, you know, if you've got one area that is not going so well, it affects all areas, especially when it comes to health. So we want to make sure that you know about this program. It's a certified holistic health coach course. You do not have to be associated with longevity in order to join the course and to learn from it. You can go to Coach with Doc, that's DOC, coachwithdoc.com, and get more information about the certified holistic health coach course. If you were invited by somebody specific, we want to make sure that you get back with them if you have any questions, but most of all, get back with them and tell them, let them know that you watched the program and tell them what you liked best about it. That is how we are able to monitor the content of our programming so that we're meeting people where they're at with the things that are most of interest to them when it comes to their health and wellness. If you have never spoken to anybody before and you would like to speak with a certified holistic health coach, I do have a team. This is for people that have never spoken to anybody. They have not bought products from Longevity. You may call, and you're invited to call, 855-949-3377. That's 855-949-3377. And then we also have our website. This program is sponsored by dailywithdoc.com, where we have replays of our past programming. We also have the good foods list that Dr. Wallach is going to mention many times. And we have additional information that helps give you those tools in your toolbox to make decisions when it comes to what is going to be, well, best for you. But let's use common sense and the research that supports it. We also have a store there too. So if you've never spoken with anybody and you'd like to purchase the products or get started, feel free to go to dailywithdoc.com. Now, without further ado, it is my honor and privilege to welcome back to Daily with Doc, Dr. Joel Wallach, who has a Bachelor of Science in Agriculture as Doctor of Veterinary Medicine around the world, with 3 postdoctorates in pathology going around the world. And if that wasn't enough, he wanted to help people too, and he became a naturopathic physician after teaching nutrition at the college level. So, Dr. Wallach, welcome to Daily with Doc.
Well, thank you, Rebecca, and thank you, team, for all being here. We're definitely family, and it's been a great almost 2 weeks. We've had lots of things doing, and so I'm sure that people enjoyed the reruns, but it's nice to be back alive. Thank you. I do want to start out today and talk about information. And of course, the book, Dead Doctors Don't Lie. Okay, Dead Doctors Don't Lie. Okay, there you go. Comes in hardcover, comes in softcover, and says it right in that little red disc up in the top. And so far, we have sold over 40 million of the audio cassettes. 40 million. The books were just now kind of getting our numbers together, and maybe by the end of this week, we'll have how many books we've sold, because we have like 3 or 4 different versions of the book, Dead Doctors Don't Lie. So we're very excited about that. And the reason why it's so, which they say, so well received by the general public, it was written to deal with their problems. It was written to deal with their problems. The thing that brought this back to me was a big study that was published by Rush University. Okay, very, very famous Rush medical university. They have all kinds of stuff going on. Every kind of thing that's done in health and medicine and biochemistry, Rush University is involved in. Okay, very famous. And they came out with a study just, I don't know, maybe a month ago now. And they said, oh, this is interesting. They looked at the top 10 causes of death in America, and then they kind of shortened their list to the top 3. Number 1 cause of death in America is death caused by heart issues. You can understand that. The heart's pretty important. You got to have heart to even have music about that, right? And so that's all the things that require the heart include life, okay, include function, include escape from somebody who, like a big lion that wants to eat you. You got to be able to run, and your heart needs to work, and so forth. So the heart's very important. Number 2 cause of death in America is cancer. Bad stuff, chemicals in the air, in the food, in the water, not taking enough nutrition to support the immune system to protect you from the cancer. And so this is number 2 is cancer, is number 2 cause of death in America. Well, here's the one that really shocked me. And this is the one that brought this subject to the table today. We started with it a week ago, but it's coming back. And that is number 3 is medical mistakes. Medical mistakes are the 3rd leading cause of death in America. Now, it leaves you breathless when you think about that, because just think of all the people who go to doctors. When you look at the statistics, each year, now this is a yearly figure, each year in America, there are, and it ranges a little bit, obviously, it's not the same every year, but it ranges between, let's see here, it ranges between 250,000 to 440,000 deaths each year in America from medical mistakes. What?
That's a lot of people, Dr. Wallach.
250,000 to 440,000 die each year in America from medical mistakes. That's from Rush University. That's not me. That's from Rush University's research. Okay, they published this, and they had it out there. They had a few news releases, and everybody says, "Oh, ho hum." Well, that's not ho hum to me. Okay, that is very, very shocking. It's that many. And then when you talk about the money well, they're treating people as they're killing them, okay, because they don't just walk in and shoot them. Okay, they'll treat them for a couple of weeks or a couple of months or maybe a year, and it's their treatment that kills them eventually. But how much did the incorrect treatments cost? Okay, it ranges from 17 billion to 25 billion dollars yearly is what we spend for incorrect treatments by medical doctors. 17 to 25 billion dollars a year. Okay, now you multiply that times 18, which is the number of years that the Nazis were killing people and all that kind of stuff. The Nazis killed 600, was it 600,000?
Is it 600?
Yeah, 600,000 human beings in that 18-year period. Well, you know how many medical doctors, human beings, medical doctors have killed how many human beings over the same 18-year period?
Uh,
6
Dr.
million,
Wallach, they did
600
that.
million.
They did
Same.
that in less than 3 years.
Oh, okay, there you go. Less than 3 years. All right. And so it's one of those things where this is why people quietly just began to self-help. They began to do things themselves. In the industry, the self-help industry, where people would go to the drugstore, they join corporations and so forth, and they would buy products that were proven in the laboratories to prevent and reverse diseases. And so they started a do-it-yourself concept for health because they love their doctor. They see him in church, they see him in school and all that kind of stuff. But the doctors weren't, what should I say, performing to the standards it should be. And so every family needs to have this book, Dead Doctors Don't Lie. It's in, I don't think it's like 17 languages. It's in 17 languages. That's why we're counting how many of these books have been sold in each language and stuff. It'll be several millions, okay? And so Dead Doctors Don't Lie covers the territory of all the common diseases, diabetes, obesity, high blood pressure, arthritis, dementia, things like that, skin problems, eczema, irritable bowel syndrome, fatty liver. All these things, okay, are simple nutritional deficiencies. They're not just due to old age. They're not due to some terrible gene you have. They're due to nutritional deficiencies, okay? So this is very, very easy. You get the book and you look it up and it gives you a little recipe. Duh, how difficult is that? And that's why people like this book, Dead Doctors Don't Lie, okay? And like I say, it's in 17 languages and it's around the world. So you can talk to anybody around the world and they know the book, they know the disc, they know the CDs and so forth. And if you have a car with a player, you can listen to it when you're driving your car. You can listen to it at home as a family and ask each other questions and so forth. And of course, the health coaches, they are terrific. They are our nurse practitioners, if you will, for longevity, the health coaches. And they do a fabulous, superb job of getting the message out to people and helping them and walking them through the process and showing them how to order, how to use these products, and how to get the best deal financially, and how to add, 25 to 50 years to your life. We're talking about pennies. We're not talking about, oh, well, a couple of $1 million, we can help you. No, we're talking very, very economical. And so I urge you to join us in one form or another. So with that said, think about it. We get rid of arthritis. We get rid of osteoporosis. We get rid of high blood pressure. We get rid of diabetes. We get rid of heart disease. We get rid of infertility. We get rid of eczema. We get rid of hair loss. We get rid of things like respiratory issues like asthma. Asthma is a very easy disease to prevent and reverse. Okay, it's a very simple nutritional deficiency disease. It's not anything to do with genetics or anything like that. Just think of all these different diseases that are out there. They're falsely, okay, designated to be genetic diseases, autoimmune diseases, and they're not. Doctors gave them those identifications because they didn't know the answer. And they didn't want to say, we just don't know yet. And so they say, oh, it's genetic. Just have to learn to live with it. We do have products that will help you with the symptoms, but we can't ever get rid of it. Well, that's not true. We we get rid of these diseases all the time, but they're simple nutritional deficiency diseases. And so with that, I'm going to turn it back over to you, Becca.
All right. Well, Dr. Wallach, one thing about having a nutritional deficiency, because the body is designed the way it is continually rebuilding cells. So if it's got the nutrition going in, the cells are, I mean, it's common sense. The cells are going to be getting healthier throughout the body,
It is true.
right?
And it's for all things, including the brain. What about Alzheimer's disease? Well, we have a big report coming out. Of course, it's this thing you have coming out from the printer. Okay.
Well, that's on, so yeah, so the flip chart, and that
That's a
has a
flip chart.
focus on osteoporosis of the skull and the things that are associated with osteoporosis of the skull, which there's a lot, Dr. Wallach.
Okay. And then, of course, we're talking about, what causes things like Parkinson's disease. Well, doctors say, well, it's autoimmune, your body's attacking itself, it's in the family. No, Parkinson's disease is demyelination. You're losing the white matter of the brain because you're not eating eggs, because doctors say cholesterol is bad for you. They give you drugs that lower your cholesterol, and they're the cause of Parkinson's disease. Okay. And Parkinson's disease, very easy to get rid of. We do have I-26 to add to the Healthy Brain and Heart Pack, the MSM, the rebound sports drink. We have, again, the I-26 and the, let's see, I also like the synaptose, so the brain cells can talk to each other. We do have a case report. Madeline is the gal's name, a patient's name. Madeline's her first name. And she had Parkinson's. I have all the hard records. And her records, and thank you for giving those to me, Becca, okay, in bold print, every year for 11 years, Parkinson's, 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 Parkinson's. Then we put her on our program for 2.5 months, 75 days, and she went in for her 12th annual physical, and they couldn't find Parkinson's anymore. So they said, okay, come back next year. And that was it.
Yeah, they said you can discontinue taking the medication.
Yeah, there you go.
So yeah, that's pretty fantastic. And I know she's totally tickled and excited, Dr. Wallach, with the things that she can do now that she was struggled with before. So that will be coming out. Yeah, but I want to kind of go back real quick. So we were talking about medical mistakes, Dr. Wallach, and how many medical mistakes are made. And so my crew is really fantastic. We were missing a zero when it came to the Holocaust on just the Jews that were killed during the Holocaust by the Nazis. So that's 6 million, almost 6 million, and altogether, Jew and non-Jew, 12 million people overall over that 18-year period, Dr. Wallach.
And that's
So,
not the military losses, that's just civilians that they killed.
yeah. And so when you take that number, 12 million, and then the report that you read where depending on the year was either 250 or 450,000, in 10 years, you would have hit 4.5 billion, million. So, I mean, you look at the numbers and compare them and how the Holocaust was just a horrible time. And then we looked at modern times and how people are passing away, not maybe because of the gas chamber or anything like that, but these long drawn out treatments, Dr. Wallach, that, as you put it, milk the cow. Well, we have hands that are up, Dr. Wallach, and we just want to thank everybody for joining us here. We do have a pretty full house, which I'm pretty excited about. Plus, we have people out on YouTube asking questions also, and Rumble. And just as a reminder, folks, if you're here live with us in the Zoom room, and if you're not, you're welcome to join us, dailywithDocZoom.com. But if you raise your hand, if you're here, go to that reactions in the Zoom menu, raise your hand, and I will be calling on people in the order that their hands were raised. I also have emails that have come in too that we're going to address. So let's go to the first hand that is up, Dr. Wallach and Sherry.
Hello, thank you so much. Dr. Wallach, this is a listener who saw you on the Charlie Ward show. She loves you.
Oh,
She's 81.
Mm-hmm.
She's 5 foot tall. She weighs 113 pounds. She has rheumatoid arthritis. So following your show, she asked her doctor to give her minocycline, and he gave her 100 milligram tablets to take 2 times a day for 2 weeks only. He won't give her any more. She has bent fingers on her hand. He says they will be like that forever. They hurt when she tries to straighten them. Her joints still hurt. She wants to get more minocycline. She really thinks that will help. Where can she get it? What can we do for her?
Okay, well, number one, she needs to get one healthy brain and heart pack in her every month and have a dose twice a day. She needs 1 bottle a month of the MSM. She can take 3 breakfast, 3 dinner. That's going to help rebuild cartilage and ligaments and tendons and connective tissue and that kind of stuff. I also have her take the collagen peptides, take a scoop of that other morning drinks with her evening drink. I also want her to have the minocycline, okay, which is an antibiotic, but she needs to take it every day, 3 times a day, 4 times a day for like 2 months. Now, the reason why the medical doctors have been, which I say, have failed to get rid of rheumatoid arthritis, they never dealt with the nutritional part of it. When you have rheumatoid arthritis, you have 2 diseases. One, you have the infection, okay, with the mycoplasma, okay, is the bug. Mycoplasma is the bug. And then they would just give them anti-inflammatories to relieve pain and inflammation, all that kind of stuff, but they never changed their diet. So they never put them on a nutritional formula like the Healthy Bone and Joint Pack to rebuild the joints. And so they always just dealt with antibiotics and that kind of stuff and just keep doing what you're doing otherwise. And that's why they have perennially, meaning every year they have tried, they have failed. Rheumatoid arthritis is one of the easiest diseases to get rid of, but it's 2 diseases. It's nutritional deficiency arthritis and a secondary infection with a bug called mycoplasma, okay? And it's killable with the minocycline, but then they have to take the Healthy Bone and Joint Pack, or if they have other issues like high blood pressure and diabetes, they should be taking the Healthy Brain and Heart Pack with the MSM and so forth to deal with the rebuilding of the bones and the cartilage and the joints. So it's more than just taking the minocycline, okay?
How much minocycline? Is that 100 milligrams 3 times a day?
Well, I can't answer it that way. I had to read the label, okay?
Gotcha.
Whatever it says on the label, depends on how it's made and so forth. And she needs to take it 3 or 4 times a day. How many milligrams are in the dose 3 or 4 times a day for 2 months, every day for 2 months, not just for 2 weeks, okay? And so by doing it for just 2 weeks and not giving them any nutrition to deal with the nutritional deficiency arthritis, they were doomed to failure from before they even started.
Thank you. Appreciate it.
Okay.
All right. Thank you, Sherry and Dr. Wallach. Let me get that. There we go. And so the killer biotic is also a good one to add to that, Dr. Wallach. I know I've helped people that weren't able to get minocycline, and they added the killer biotic in there, where minocycline will work faster. The killer biotic still has some herbs and nutrients in there that help as well.
Okay.
With
Thank you.
fungal, all of them. Well, let's go over to a question that I have here in Facebook, or sorry, in Zoom, and actually YouTube. Paulina wants to know, are bunions the result of osteoporosis?
Yeah, bunions are a mixture of osteoporosis and arthritis, and maybe some deficiencies of collagen and ligaments and tendons and stuff like that. So because there's pressure being inflicted every time you take a step or move your ankle or anything like that. And if you're not taking all the nutrients necessary for all those pieces to work properly, you get bunions. So it's more than just, well, take more calcium. No. You have to take the whole thing. And you can use the CM cream topically on the bunions for discomfort and swelling. Okay, that'll help quite a bit, the CM cream. Okay.
All right, thank you so much for that, Dr. Wallach. And let's go to Phyllis, who has her hand up. Phyllis, go ahead and unmute yourself.
All right, Doc, I've got a question from Annette, and she is on both Facebook and YouTube. How about that?
Wow.
She is 5'7", 150 pounds, 83 years old, has neuropathy in her toes only, no other health problems. What can we do for her?
Okay. Well, this is not unusual. Even though she probably has osteoporosis in every bone in her body because of her activities, how she walks, where she goes, and all this kind of stuff, how she sits, what kind of chair she uses. She's having the obvious things going on. Neuropathy, this is, she's got either a lot of pain or she can't feel anything, one or both going on there, okay? And so you say she's 150 pounds, correct?
Yes.
Okay, 150 pounds. None of the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, no butter, and oats, no buckwheat, no sugar, no carbonated drinks. Even the diet drinks and the carbonated water need to go. And then at 150 pounds, I want her to have 2 healthy brain and heart packs a month, a full dose thing twice a day, 2 bottles a month of the MSM. So you can take 3 at breakfast, 3 at lunch, or dinner time. That's going to help her regrow cartilage and ligaments and tendons and connective tissue and that kind of stuff. Take the pressure off the nerves, because you have the sciatic nerves coming down, where the spinal cord bifurcates, and you get a sciatic nerve going down one side and another sciatic nerve going down the other side. When they get squeezed, this is where you get neuropathies, and they can be painful. They can be lack of pain, that kind of things, lack of being able to feel anything. And so this is why you need to do more than just take an aspirin, okay? Also, she needs to take, let's see, and use some of our CM cream topically on her toes and her foot and her ankle. If you say she's just got neuropathy in her toes, the problem is much higher up. Could be around her skull, could be in her back, it could be in her hips, could be at her sacrum kind of thing, okay? And so she needs to have also in addition to everything we talked about, she needs to have the CM cream to put locally, and that's going to help immensely, okay?
I know you say when we have osteoporosis in one place, we'll have it a lot of other places as well.
Exactly, you'll have it in other places. It's just because of how they move, what they're doing, going upstairs or not going upstairs, how they get up out of a chair, if they're lifting packages. This causes the arthritis in a place to flare up. But if there's nothing going on there, you can have arthritis and there's no pressure on it from movement or anything, then you might not know that you got arthritis in that joint.
Great to know. Thank you.
Thank you.
Thank you, Phyllis. And let's go right over to Lawrence. Lawrence, go ahead and unmute yourself.
Hey, Doc Wallach.
Hi.
Hey, Becca.
How are you?
I'm doing fine. Thanks for asking. Hope you all are well as well.
How can we help you, sir?
Got a question for you about my wife's GERD. She has acid reflux, and it's starting to get into her esophagus. And wondering if there's anything that we can do to help her out.
Okay, how old is she?
She is 40.
Okay. Let's see here. How much does she weigh?
190, and she's 6 foot.
Okay. And then does she have any other issues? Does she have any ringing in her ears or dizziness that she complains about?
No, sir.
Okay, how many times does she wake up at night to urinate? Do you know? Once,
0.
2 times, 5 times, never?
Never.
Okay. Yeah, let's see here. I would make sure, okay, that she is taking, let's see here, 190 pounds. We're going to have 2 healthy brain and heart packs per month. Get rid of all the bad foods. 2 healthy brain and heart packs per month, full dosing twice a day, 2 bottles a month of the MSM. Take 3 at breakfast, 3 at lunch, 3 at dinner time. Take the collagen peptides, a scoop of that with her morning drink, scoop with her evening drink. And for the acid reflux, we're going to have our we have these various enzymes, okay? Our ultimate enzyme, okay? I like the ultimate enzyme. I take them. I don't have a problem. I just take them to take them, okay? And she can take 2 or 3 of those, say 5 minutes before each meal. We take a couple of bottles a month of our ultimate enzymes, and that will do wondrous things for this. But also wouldn't hurt for her also to throw in our seasoned salt or our Himalayan salt, because stomach acid is made from salt. Your stomach takes salt, sodium chloride, and makes hydrochloric acid. If she's avoiding salt, this may be her basic underlying problem.
Good point. Okay.
Okay.
Thank you, sir.
So she's going to have a great story.
Will do. Thanks, Doc Wallach. Thanks, Becca.
Thank you, sir. Bye-bye.
Bye.
All right, thank you. Dr. Wallach, let's go to a question that I have here from Natalie. Now, Natalie is 65 years old, 159 pounds at 5'2". She's on the Healthy Body Pack, the Cardio Beats, and the Ultimate Daily Classic. She's having issues with her heart rate, which beats irregularly. Highs are 120 to 160, all the way going down to lows of 48 to 50. But she's also having thyroid issues, even on medication. Her thyroid is high on the T4 free, low on TSH, and high on the T3 free. So
Okay.
what would you recommend?
Okay, well, first of all, the gotta get rid of all the bad foods. No fried foods, no processed meats, no oils, no glutens, no wheat, bran, rye, oats, no buckwheat, no sugar, no carbonated drinks. Even the diet ones got to go, and carbonated drinks got to go. And at 100 and can't read my own right here, 159 pounds. Is that correct?
Yes, that's correct.
Okay, 159 pounds. I want to have 2 healthy brain and heart packs per month, right? We already
Yes,
talked
sir.
about that. Okay. But I also want her at 159 pounds. I want her to take, again, the 2 healthy brain and heart packs a month, the 2 of the, let's see here, MSM, the 2 bottles of MSM. So you can take 3 at breakfast, 3 at lunch, at dinner time. I want her also to have, again, our ultimate enzymes. She could take 3 of those at breakfast, 3 at lunch, or at dinner time, say 5 or 10 minutes for each meal. Okay. And then we also want her to use our salt, a seasoned salt, or our Himalayan salt. Okay. And a irregular heartbeat, this can be called AFib, atrial fibrillation. And doctors want to use a horrific treatment. They anesthetize you. They take your heart out of your chest and hit it with all kinds of electricity. And it has the highest death rate of any medical treatment. So it's called ablation, cardiac ablation. So you don't want to do that one. Okay. And so basically, this is caused by osteoporosis of the skull. Do you know how many times she wakes up at night to urinate?
She did mention she wakes up once or twice.
Okay, yeah, so she has osteoporosis of the skull. They may be squeezing that 10th cranial nerve, which is causing the irregular heartbeat. It's called AFib, atrial fibrillation. Okay, and it's easily dealt with the program we've just laid out here. She can take the Cardio FX, take 2 doses a day of the Cardio FX. That's also going to help her. And let's go with that program, okay?
All right. Thank you so much, Dr. Wallach. And now let's move right over to AJ. AJ, go ahead and unmute yourself.
Good day, Dr. Wallach. How are you?
Fine, sir. How are you doing?
Doing very well, thank you. I have a few questions from a woman named Kate in the UK. The first question is about her daughter, who's 11 years old, about 57.5 pounds, 4'7". The last 4 years, she's had serious episodes with pneumonia, collapsed left lung a few of those years, and bronchitis. Every time in autumn, she's had antibiotics and recovered. Doctors say she has an asthmatic condition that caused the pneumonia. She's using a corticosteroid, Clenil, and she's wondering, because she's okay in the spring and summer, does she need to continue to take the steroid while she's on the 90?
Well, she needs to be on the 90 every day, not just in the springtime. Okay. And so about these medications, I'm not going to say anything about that. Okay. But I will say that all these lung diseases are very simple nutritional deficiency diseases. Okay. And you say she weighs, let's see here. We have
57.5 pounds.
Okay, 57.5 pounds. Okay, these are American pounds. Okay, but she lives in the UK, right?
Yes, sir.
Okay, so she needs one of the healthy brain and heart packs per month. Take a half a dose a day. Okay, so excuse me, half a dose twice a day. Half a dose twice a day, and then I also want her to have the let's see here. I would go with the ultimate enzymes, take a couple of those, say 5 or 10 minutes for each meal. I also want her to take the Oxybody, She can take 2 doses of that a day at her body weight. She could take a half ounce of the Oxybody, say a half hour or 15 minutes or 10 minutes before breakfast, and again before dinner time, Oxybody. And let's see here. It wouldn't hurt also for her to use our rebound or sports drink. That's going to give her another source of these nutrients. Okay. I think they probably have the canister over there. So it'd be 1 scoop at her body weight once a day. Okay. She can have 1 dose of our rebound sports drink. She'll get 75 minerals and 25 vitamins, amino acids. That's in addition to what's in the Healthy Brain and Heart Pack. And she needs to ramp up on all these things so her body will perform properly. Okay.
Thank you, sir.
Okay.
Just 2 quick brief ones. One may be a Becca question. She says she's interested in buying the TMR, total meal replacement shake for her 11-year-old, but we don't think it's available in the UK. How can she deal with that?
Okay, I'll leave that up to you guys because I don't deal with the shipping. I apologize.
Okay.
Yeah, we'll have to verify to see which shakes are available in the UK.
It was the plant-based shakes that I saw that were available, but not the TMR. And then her last question is, as she's cutting sugar, she's asking about one called erythritol, which when I looked it up, it said it was derived from corn, but it did show some side effects. And she's wondering your opinion on it.
Okay, why does she need extra sugar? If she eats fruit, okay, she doesn't need to have outside sugar.
Right.
Stay away from all the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, no bar, rye, and oats, no sugar, no carbonated drinks. Even the diet ones got to go, and carbonated water got to go. And so when somebody asks me, well, is this type of sugar better than that type of sugar? It's kind of like saying, is a copper jacketed bullet safer to shoot yourself in the head with than just a lead bullet?
Understood.
AJ, erythritol can cause stomach distress, gastrointestinal distress, and I have very bad reactions to it, like I do gluten. So I would not recommend erythritol to anyone.
There you go.
Thank you.
You're welcome.
You guys are the best. Thank you.
Thanks,
Hey.
AJ.
Your family, brother.
Awesome. Thank you so much, Dr. Wallach, for that. Thank you, AJ, for bringing those questions all the way from the UK. And thank you for asking the questions, folks, because that's what this program is all about, is making sure people have answers to the questions that they have in regards to what they can do on their own to help make a better health journey. And so, Dr. Wallach, I know there's a lot of different sugar substitutes out there. When you're baking, you want a little bit of sweetness. So there are some things that don't affect your blood sugar, but we do want to make wise choices on those things, because many of them, as Ruth Ellen had mentioned, do have digestive complaints and irritations associated with them. So let's go over to JT, who has his hand up. JT, go ahead and unmute yourself. And if you'd like to come on camera, that would be fantastic. There you are.
Hi, Becca. How are you?
Fantastic.
Yes, sir. How can we help you?
Hey, Doc. This is a little bit different of a question for me this time. I've got a couple little dogs, and they've been excessively licking things like the carpet or the coffee table. And the vet says that they're nanny dogs, but it sounds a lot like cribbing. I'm wondering if you could say anything about salt licks for dogs, if that's a thing, or if cribbing.
Sure. We have actually what we call Arthrodex. It's one scoop for 20 pounds of body weight, Arthrodex. Okay, there you go. And that's exactly what you need for this case. And you want to give them a good basic dog food that has vitamins and minerals in it. Okay, you don't want to, just give them some meat you buy from the store. You want to give a high brand of canned dog food with vitamins and minerals added to it. In the old days, prior to 1900, pet dogs used to live to be 4, 5, 6 years in a house. That's how long they would live. When they came out with canned dog food and used all the research they've been studying in in the university research labs, they started putting all these vitamins and minerals into dog food. Suddenly now they're living to be 12 and 15 years of age.
Mm-hmm.
So
that's great. They did start having a skin reaction to something. It might not have been the Arthrodex, but is there anything that you would add on for? They almost look like little pimples or something like that.
Yeah, well, again, I would go with the Arthrodex. I never had anybody complain about Arthrodex.
Okay.
But we do have hair, skin, and nails. You can kind of grab onto some of that. And
Okay.
a couple of capsules to the dog. Okay.
Cool. Okay, I'll give that a shot.
Yeah,
Thank
let
you.
us know how it goes.
I will.
Essential fatty acids for the dogs. I know they're important for skin also, Doc.
The which?
Essential fatty acids.
Oh, yeah.
So I could take one of those and drizzle it on top.
Yeah, or throw it down his throat and rub their little throats. And they, when you rub their throats after you give it to them, they'll open their mouth. They give it to me so I can have you rub my throat.
Okay, I'll give that a shot too. Thank you.
All right, thank you, JT. Well, Dr. Wallach, we've had some great questions today. We've got a few more minutes here, and I have a question in regards to grounding. And is it better to ground while you're taking the nutrients? Does that make any difference?
You're talking about grounding. You're talking about reading something that's going to help you.
No, we're talking about like becoming one with the earth, whether it's walking through grass, on sand, minerals, or there's even grounding mats that help to neutralize the energy.
Okay, well, grounding can be useful, but these are dangerous times. And for, say a mother with a couple of kids walking through a field, I'd be a little nervous about that with all these crazies out there. And so I wouldn't be suggesting that. If they have a backyard and a couple of 25-year-old sons, they're bodybuilders, let them be there while the kids are grounding in the backyard.
Well, Dr. Wallach, not everywhere is horrible, okay? But they don't have to have 25-year-old sons. I thought you were going to go with the chemicals that are used to control weeds and all of that stuff. And because anything that touches our skin is going to absorb into our skin. So the whole process of grounding is
get a goat. Leave the goat eat the weeds.
Goats stink. Okay. I've had goats.
Well, that'll keep the bad guys away too.
Okay, I'm not gonna go there. So and Dr. Wallach, we've got another question that has to do with osteoporosis of the skull. So this individual has been experiencing numbness in their hands. I'm going to assume, okay, maybe I shouldn't assume that it might be linked to osteoporosis of the skull, but there's numbness, like no feeling on the fingertip.
Okay, well,
So
here's
when
where
they
the
try to
skull is squeezing, the skull is squeezing the spinal cord, and the nerves that go down the arms to the fingers come out of the spinal cord. So when the skull is squeezing the spinal cord, this is why you get urinary problems way down the other end. Okay, you get sciatica, okay, when you have osteoporosis of the skull, because these nerves go long distances. And that's why I like the book, It's All in Your Head. Get that book and CD set. There you go. And it shows you what the skull looks like when you have osteoporosis. It also shows you a skull, and each chapter in the book represents a cranial nerve and tells you all the different symptoms and diseases you can get when those cranial nerves are being squeezed by osteoporosis of the skull. Okay. And so this is a wonderful little book. And we wrote that because doctors know nothing about this. I repeat this, doctors know nothing about this. And people would be sent to various specialists for surgeries and drugs and all this kind of stuff just to treat the symptoms. But they never knew that they had osteoporosis of the skull, and they could get rid of all these problems by taking the Healthy Brain and Heart Pack and the MSM, that kind of stuff. Okay. And make sure you're getting rid of all the bad foods, you can maximize absorption, rebuild the skull, take the pressure off those 12 pairs of cranial nerves in the spinal cord. And many of these diseases you've had since childhood will go away in weeks. It just freaks everybody out. I've had this problem for 30 something years, and in 2 weeks time it went away on this program. You got to push the correct button.
You have to push the correct button.
Yeah, to get the right result.
Oh, okay. So just throwing something at it to mask symptoms is not the right button.
No.
All right. Well, and I found that when I threw stuff at the symptoms to mask them, to get rid of them, it caused more issues, Dr. Wallach. So that's what I like about your program, is because it's working at the cellular level, giving the body not just the macronutrients that it needs, but even the micro and trace nutrients that the body needs, where everything is synergistically working together. So I just have to say thank you, Dr. Wallach, because if it wasn't for that, I don't know that I would be so excited to be here today. So I am excited.
We thank you. We thank you for sharing, because you could just run away. So we thank you for taking your time and your energy to share with the world. And so you're definitely one of the family.
Well, thank you so much, Dr. Wallach. I don't plan on running away and then not coming back every once in a while. You know, life happens where we have to, you know, spend some time in life and do other things. But I'm just glad that we are able to bring this information to people, Dr. Wallach, because we are living in a world where he mentioned in the beginning of the show, top 3 killers: heart disease, cancer, and doctor mistakes. Folks, give your body what it needs, so that even if you do have to, you know, work with a doctor and have to have some type of procedure that nutrition just isn't helping, at least the cells will be strong enough to be able to allow you to just soar and thrive through whatever treatment it is. And then if there's recovery time, I've had some people where their doctors say, I can't believe how quickly you've recovered. So that's the nice thing about keeping the body nutriated, Dr. Wallach, because even when it does go under some stressful times, it's able to bounce back. Well, I know you have another program to get to. I just want to say thank you for bringing to us information over decades. You've been at this a long time. like
Well,
longer
Rebecca,
than
this is only the
life.
beginning. This is only the beginning. Remember, the Huns lived to be 120. Okay, that's now. This isn't biblical time. This is now. They live to be 120 because they're getting the minerals. Okay, and then of course you go to biblical times. People, they lived to be 900. Adam lived to be 930. Let's see here. Noah lived to be 950. Methuselah lived to be 969. And if that's true, which I believe it is, guess what? There's no reason why we can't get there also, but it has to be a priority. It can't be just once you do it on Easter. No,
Right.
it's got to be 3 times a day.
That's right. Well, let's see. AJ has his hand up real quick. Let's see what
Okay.
AJ has to say, because I may have forgotten something. AJ?
No, Doc, just a real quick question. We have a 230 pound superior professional athlete with a torn Achilles. What kind of thing would you recommend for them to do?
Okay. Well, it certainly has to be connected. If it's torn but not totally transected, where it's 2 pieces flapping in the breeze, but if it's torn but still hooked up together, okay, at 200 plus pounds, I'd have them take 250 pounds, 230 pounds, whatever it is. I'd have them take 2 of the healthy brain and heart packs a month, none of the bad foods. 2 healthy brain and heart packs a month, full dose everything twice a day. 2 bottles of MSM, so you take 3 at breakfast, 3 at lunch, 3 at dinner time to rebuild cartilage and ligaments and tendons and connective tissue, right? Very important here. And then use the CM cream topically wherever there's pain, okay? Whether it's a joint or the space between 2 joints, use a CM cream. It'll give you about 2 or 3 or 4 hours of pain relief. And then, let's see here. Also, I would throw in the I-26, okay, because it deals with nerves, the spinal cord, the brain, and like the sciatic nerves and stuff like that, the nerves going down in the arms, the spinal cord. And so the I-26 will be very helpful there. And so let's go there. Don't forget the rebound. This is an athlete. He needs to rebound. Our rebounder sports drink with 75 minerals in it and 25 vitamins, amino acids. That's in addition to all the other stuff. Okay.
Yes, sir. Thank you,
Okay.
Doc.
God bless you all.
All right. Thank you, AJ. Thank you, Dr. Wallach.
I apologize. I got to run.
Bye for now. Now, everybody, we just want to say thank you, everybody, for joining us here. And if I could get my co-hosts, in addition to AJ, on the screen with me, that would be absolutely fantastic. And there was a question that came up in the chat in regards to Himalayan salt and longevity. If you go to the website, get with your distributor, whoever you're working with, they can do a search for salt. We have several different combinations of salts and herbs that are available that include those whole salts, not like the salt that's been stripped all the minerals and then they add iodine, not that kind of salt, but we're talking about whole salt. And we have it with the Savor Foods line has it with different herbs to help complement your cooking as you are making spectacular healthy meals for yourself and your families. Well, I just want to say thank you to my whole entire team. They have been fabulous. I know I'm going to start with AJ and Ruth Ellen because the two of them kept the replays going so that Doc and I could take some time off and take care of some other stuff. So thank you so much, Ruth Ellen and AJ, for doing that. I want to thank, oh goodness, I don't know who to say next, but Marilyn, thank you again for all the information that you were putting into the chat today. And I saw that Phyllis was putting some in there also. Thank you, thank you. You both do just a fantastic job, and just using your heart to help people is something that I just love about the two of you. Well, all of you. And Sherry, as Sherry is bringing questions from the clients, and Phyllis also from the clients, in their own practice of being a certified holistic health coach, and then also from the different platforms and within Zoom of the people that are tuning in. Thank you, thank you. And Albert also joining us from way far south in South Africa. We want to thank you, Africa, for representing Africa with your buddy there, the giraffe. Thank you, Albert, as you're helping let people in and monitor the cameras to make sure that we're keeping this a safe place where people are not, doing anything that they shouldn't do on a program that is a resource to a very amazing community. Well, folks, thank you again for joining us here on Daily with Doc. My name is Becca Dukes. Come back and join us tomorrow on Daily with Doc, zoom.com. Don't forget to check out the course at coachwithdoc.com. And we are running another giveaway. So go to dwdgiveaway.com and sign up as you are helping us get that message out and sharing to your audiences. Because one person, Dr. Wallach found, can only do so much. So he created an army, a crusade. And that crusade is what we are part of to get this information around the world. So as I'm reaching my community, you're reaching your community, and all of us around the world are doing the same. We can make an impact in the world. So until next time, bye for now.